This one is a controversial topic. Some people believe in having a birth plan and others believe in having a preference list. So your birth is coming to term, you're almost there, baby's almost being born, you're around 30 weeks and you want to start thinking about your options and what you're hoping to achieve in your birth. A birth plan or a preference list? Which one did you go for? Why is one better than the other? Let's find out in this video. Hi again and welcome to another video. My name is Naomi Karemi if you're new in this space. Today, I want to touch a little bit about the art of creating a birth plan, one that is not only straightforward, makes sense, but one that will be respected when you go to your hospital or when you attend with your midwife practice. So what is the difference between a birth plan and a preference list? I love to call it a preference list because when you utter the word plan, it comes across as something that is already put to stone, and birth, as we know, is an event. As an event, you can't really guarantee how it is that it will evolve. A preference list, on the other hand, is more like a library. It gives you a list of options. If A does not work, maybe B will work, and if B does not work, C is okay, and maybe E sometimes will have to come after G. Then you play with the options. It gives room for negotiating. It gives room for discussions. And that is where the trick is. Many healthcare workers, nurses, midwives, gynecologists, if there's anything that comes across as, is this term or the need for the birthing couple to have so much control over something that even they as professionals can never have control over. And so how would you create a list that is flexible, but one that can be respected? The one way to do it is to make it clear and straightforward. You can have a point, but if it's going to take you a whole full skirt to explain that point, then that will make it even more complicated. So find somebody else after you have created your preference list and see if you can discuss it. Maybe it's your partner and see if it makes sense. 2, make sure it's on one page. The reason why you want to make sure that your birth plan is on one page is because should you turn up in any hospital setting and you find that it's a busy shift, it will not take a lot for people to understand what your hopes are in how you want to achieve your birth. If you have a birth plan that has like 7 or 8 pages, the risk of having a birth plan like that is that anything that may be important to you may be missed. The third one is to see if you can get your doula or whoever to try and create a birth plan for you that is a pictogram. I have just tagged an example in the video and you can see what a pictogram birth plan looks like. I love creating them like that because they are so direct, but also I find that people connect better and quicker with visuals. So even in a busy shift, they will never miss what a pictogram said. And underneath it, I just explain what that picture means if it's not clear enough. The fourth point is discussing your draft with your midwife or your care provider. That could be your gynecologist or obstetrician. Take a draft that is not complete yet and just explain it to them that you're already thinking of a birth plan or a preference list for yourself, for your birth, ahead of time. The benefit of having a draft is that you can always take notes of their advice and recommendation and then you can finalize it after that appointment. So usually many doulas would attend the birth plan appointment so that they can leave with notes to create the final draft. At least that's how I work. And so to summarize, I find that a plan kind of puts a lot of pressure in how you want to have your birth. And so it makes other people feel uptight maybe. And maybe that's part of the reason why many times when women have turned up with a birth plan in a hospital setting, some women have reported being welcomed with somewhat of a frown. It's because some people believe that once I've put it down, I have already evaluated, it's been researched and looked upon and then finalized. Now, when you think about it in that sense, it kind of adds a bit of a pressure. It makes everybody else become a bit uptight in what your wishes are and how they're going to be able to provide and make those wishes come to fruition. It's not the kind of pace you want to be in when you're in a hospital setting. A preference list, on the other hand, it actually creates a lot of space for discussion and a lot of space for negotiating, a lot of space. It kind of makes it an open book. It creates an opportunity to explore other possibilities and other options. It may be that the ones that you have put down on your birth plan, there are extra that you were not aware of, because protocols and hospital protocols, especially and hospital settings, they change every time. Back in the day, they never used to have gas and air. Gas and air, I knew it from the UK, working in a maternity unit, like they call them, or the birthing suites. But when I arrived in the Netherlands the first time, 10 years ago, they didn't have gas and air. So there's always going to be new things like the CTG machines. These days, you don't have to be strapped in a bed. You can have them monitor the baby from outside your own room, but also while you're sitting in the toilet or you're having a shower. These days, they're actually made to be waterproof. So just be open that with a list, you may be able to even have something else that is suggested to you that you never even thought about. But because you have created it to be so open and welcoming, it creates that pace and it creates this welcoming effect. And that is normally how they want it to be presented. If I ever advise anybody, is to go with a list and not a plan.